work that we have done over the last 2 years demonstrate that we have the will to make those changes.
Access to family doctors, decentralized management, and limiting ER wait times to 90 minutes by setting up command posts. Just some of the 50 measures the Quebec government is planning to implement as part of reform of the healthcare system by 2025. Tuesday morning, Health Minister Christian Dube said at a press conference that the measures are ambitious but promises to deliver, adding that the pandemic only reinforced the need for change.
We don't want to live through being dependent on the system, being able to force people to do things they don't want to do because the system could not follow the pandemic.
The plan highlights some solutions to the system's challenges, including eliminating forced overtime for healthcare workers.
Forced overtime has impeded the quality of life of nurses at home and has made their work conditions much more unsafe, because when a nurse is forced to work overtime, it's very exhausting. Now we're already working short staff. Then if we eliminate forced overtime, we're going to be working extremely short staff. How are we solving that problem?
Dube says he wants to hire at least 1,000 nurses and 3,000 clerks to take on some of the bureaucratic tasks that now fall to clinical staff.
It's ambitious. What's written down in the 80 pages cannot be done in 3 or 6 months. And I understand it has to be in years. Like if it's giving 2025, we understand it. But on the short term, when you talk about working conditions, when you talk about working with employees, making the right choices into the schedules and everything around that, that can be done rapidly.
The government no longer promises that every Quebecer will have access to a family doctor by the end of their mandate, with almost 1 million people not currently paired with one. But they plan to set up a phone line by the end of summer for a one-stop service known as the Guichet d'accès à la première ligne, where a nurse would direct patients to the appropriate medical service, whether that's seeing a doctor or lining them up with some other method of care. A pilot project is already in place.
We start slowly. We start in certain regions. As I said, probably about 50% by the end of the summer. People will be able to go through that, but I want more.
Other measures include digitizing the healthcare system, giving nurse practitioners, paramedics, and pharmacists more power to treat patients, paying family doctors more for every patient they take on, expanding telehealth services throughout Quebec, putting more money into seniors' care, including better meals in CHSLDs, a shift towards home care, continuing to use private clinics to catch up on surgeries, and additional hospital beds. Opposition parties are slamming the document, describing it as more of an electoral platform than real health reform, with the provincial election slated for October 3rd, and a dollar amount has yet to be allocated to these measures. Dube only reiterating the budget increase of 6.3% for the health system in the coming year that was laid out in the March 22nd spring budget.
It's what we all wanted to hear. Is it going to be applied as the next step? It's election time right now. So let's see. Right now I need to see it to believe it.
In Montreal, Alysia Rubertucci, City News.